My name is Megan Walsh, and I'm the Director of Behavioral Health. I've seen the Valley come together to support individual kids, to support groups of kids, teams, families. People just want to help. They want to know their neighbors and they want to help. And the issues that we face in mental health are not easily solved. And sometimes it's not even about solving. Sometimes it's about learning to embrace whatever the issue is and learning to lean into it and figure out how we can help families to create a life of beauty and connection and joy in the midst of some really challenging things. That's what kind of really lights me up when I can come alongside people and help them to embrace who they really are as a person. At Encompass, we're working really hard to recognize and appreciate neurodiversity. Our therapists are very focused on making sure that the services we offer are welcoming to kids and families whose brains maybe work a little bit differently than typical. And so we work really hard at Encompass to look at each individual child and look at each individual family and tailor the services that we're providing to the way that their brains work. One of the tools that we use here at Encompass is our parent observation space. You can see here we have a headpiece where we can hear what's going on inside the therapy room and a one-way mirror so that we can also see what's going on, and we can coach the parent in how they interact with their child. So helping the parent to interpret the cues their child is giving and help them notice what's working and what's not working in the relationship. So play-based therapy at Encompass is really the nuts and bolts of what we do. We know that kids learn best through play, and actually studies show that kids learn 400 times faster through play than any other means. So we work really hard to help parents and teachers and other caregivers understand that if they want kids to learn, if they want kids to change their behaviors, then if you do so through play, it's going to be much more effective. At Encompass, in the Behavioral Health Department, a positive outcome looks like a child who is connected. A child who's connected to a parent, to a teacher, to some other adult. We know that kids are much more able to be successful in later life if they have solid relationships. And so for me, it's not about necessarily changing a behavior, although that happens with connection. It's about making sure that that child is connected to a safe, loving adult.